Welcome guys to my YouTube channel. My name is Dr.Mwirigi. Yesterday we discussed about pelvic inflammatory disease, what it is, the causes and the symptoms, what the patients complains of. And we promised in the next session to discuss about the physical examinations, uh, the clinical diagnosis, the findings, and the mode of treatment. So in our physical examination, uh, we are going to use a mode known as palpation. That means we'll have to touch a patient's pelvic and the lower and the abdomen, so that to find some signs which might be suggestive of pelvic inflammatory disease. So one of the signs that we are going to find is the lower abdominal tenderness. That means there is pain when you touch the lower abdomen of the patient. They complain of pain. The next one is adnexal tenderness. Adnexal tenderness is pain in the area of woman's uterus. Is actually a Latin one that means uterine attachment or appendages. The next one is cervical motion tenderness. And remember, pelvic inflammatory disease is primarily a clinical diagnosis, and therefore presumptive diagnosis is sufficient actually to initiate an empiric antibiotic treatment of the same. Remember, a pelvic ultrasound is very useful here because you need to rule out other causes of lower abdominal pain, because the other causes of lower abdominal pains other than pelvic inflammatory disease like abscesses, ectopic pregnancy, ovarian cysts, and many more. So what will you use for treatment? How do you treat this disease? But you have found is the clinical diagnosis this patient has pelvic inflammatory disease. We use the third generation cephalosporin used known as ceftriaxone. We give it intramuscularly 500 milligrams start, but we give it intramuscularly and not intravenous because when given intramuscularly, it provides sustained drug levels in the blood. And alternatively, you can give oral, that is, patients will have to swallow a drug known as cefixime, 400 milligrams start, and you combine them with the doxycycline, 100 milligrams, 12 hourly for 2 weeks, and metronidazole, 400 milligrams, 8 hourly for 2 weeks. Alternatively, you can use a gentamicin, drug known as gentamicin intramuscular. Gentamicin is an aminoglycoside. Aminoglycoside is actually treats it's a drug that actually treats a wide variety of aerobic infections, and you can give it 240 milligrams to start. You combine it again with the doxycycline, 100 milligrams 12 hourly for 2 weeks, and you combine again with metronidazole, 400 milligrams 8 hourly for 2 weeks. Remember, doxycycline and metronidazole, they have a high effect of emesis. That means the patient will feel like vomiting or start vomiting. So you need to look for an additional drug that is going to counteract this side effect. That means you give antiemetic of your choice. You can either use ondansetron or promethazine, any antiemetic of your choice, to counteract these effects. Remember, this disease is treatable, but if there is inadequate treatment of the same, there are complications that follow, which we are going to discuss in the next session. The complications that arise due to inadequate treatment of this disease, and the preventive measures that are required to prevent this pelvic inflammatory disease. Thank you very much, guys, and don't forget to subscribe to my channel as we continue learning more and more. Thank you very much.